Dr. Gaurav, is he present? Yeah, please. This paper was awarded the best paper last year. Outcomes of inferior turbinate tarsal fracture for congenital nasolacrimal duct obstruction.
Hello everyone. This was a paper regarding the inferior turbinate efficacy and safety outcomes in cases of congenital nasolacrimal duct obstruction complicated by the inferior turbinate impaction. I have no financial disclosure. Congenital epiphora presents in almost 20% in the newborn cases, with 90% resolving in the initial first year and the 60% resolving in following year. The remaining are diagnosed as congenital nasolacrimal duct, which are treated with a variable intervention with the variable success rates. On reviewing literature, the unanimous consent was there that the success rate of the probing alone decreases with the increasing age, and which will subject them to more to the invasive DCR. Like it's 97% success rate for the probing in the cases of the children lesser than the 36 months, and merely 43% to the children above the 48 months. Whereas the inferior turbinate infracture in the complicated cases is less invasive and can have better outcomes when performed under nasal endoscopy. With this in mind, the purpose of the study was to identify the efficacy and safety of inferior turbinate infracture in cases of CNLDO in 69 eyes of 55 patients. Under general anesthesia, the punctum was examined for the nasal pathology, and the upper punctum was dilated with using the natal ship dilator, and the probing was done with an age-appropriate Bowman probe. After finding a bony block, the nasal endoscopy was done to identify the distal end of the nasolacrimal duct, inferior meatus, and inferior turbinate position. Using the lens spatula, the inferior turbinate impacted towards the lateral wall was medialized towards the nasal septum, and the patency was identified with the visualization of the nasolacrimal probe at the ostium, followed by this patent syringing. The patient was discharged on antibiotic and tapering steroid eye drops. The patient was followed up at 1 week, 4 weeks, 3 months, and 6 months, and then annually. All the patients were graded as successful with the patent syringing on the table and a negative history at the 3 months follow-up for the epiphora and discharge with a negative fluorescent dye disappearance test. Now coming to the results. We have reported a total of 55 patients with a mean age of 29 months, having duration for a mean of 27 months. It included a quarter of bilateral involvement, and the rest had the unilateral with 17 in the right eye and the 24 in the left eye. Here is a case of the 3-year-old child presented to our tertiary center with the congenital epiphora persistent even after the Krigler massage. He was diagnosed as a refractory congenital nasolacrimal duct obstruction. He underwent initial probing followed by an inferior turbinate infracture under general anesthesia. On table, there was a successful syringing followed by a 3 months also had a successful outcome. After syringing, 63 patients had a clear patent nasolacrimal duct, with 6 having the atonic sac. All but 1 had a successful outcome. Among the atonic sac, Krigler massage was advised, which led to the resolution in 2, and the rest were subjected to DCR. Coming to the discussion, this table presents a comparable and summarizes the finding of the present study with the previously published data. In the previous literature, Ataxata and Khamenei has presented a resolution of CNLDO with inferior turbinate fracture as significant in comparison to initial probing. The main reason of this can be they have done the procedure under the younger age group without the confirmation of the inferior turbinate impaction, and it was done as a blind procedure, hence the insignificant results. Our case study was unique as it was done under the older children group, which had 69% more than 18 months with a successful outcome. Finally, we would like to conclude that inferior turbinate fracture is a quick, completely safe, effective intervention and can prevent from the more invasive DCR. We will be recommending that if a child presents to you younger than 12 months with an epiphora, Krigler massage is the first thing. The initial probing can be tried at 12 months of age. If failed, it can be repeated again, but it should have to be done under the nasal endoscopy. If an inferior turbinate impaction was found, the infracture will be the appropriate choice, and if failed, then we can go ahead with the DCR. These are my references. Thank you for your attention.